2016 has been a remarkable year in the fight against malaria. In February, India launched a new strategy with an ambitious goal: reducing the national malaria burden to zero by 2030. The strategy builds on major progress in malaria control, including a more than 50% decline in cases nationwide over the last 15 years. In April, WHO declared that the European region was malaria-free. For the first time, all 53 countries reported at least 1 year of zero locally acquired cases of malaria. On World Malaria Day, WHO reported that 21 countries are in a position to eliminate malaria by the year 2020. 6 of these countries are in the African region, which continues to bear the heaviest malaria burden. Progress in the malaria fight has sparked renewed discussion around the ultimate goal of global eradication. In August, WHO convened a first meeting of the Strategic Advisory Group on Malaria Eradication. This group of global health experts will advise WHO on potential scenarios that may support the eradication of malaria, including expected costs and timeframes. All regions affected by malaria have been moving quickly to develop action plans to tackle the disease. The Eastern Mediterranean led the way, with the launch of a regional action plan in 2015. Leaders of the African region approved their own malaria framework in August 2016. A malaria action plan for the Americas followed in September, and for the Western Pacific in October. All regional plans are fully aligned with the WHO Global Technical Strategy for Malaria. The strategy aims to reduce malaria cases and deaths by 90% by 2030. In September, Sri Lanka was officially certified by WHO as malaria-free, an event that made news headlines around the world. The same month, WHO reported on progress in the malaria fight across the Greater Mekong sub-region. According to WHO data, 6 countries in the sub-region cut their malaria cases by 54% between 2012 and 2015. Malaria deaths fell by 84% over the same period of time. In November, WHO released the results of a major 5-year investigation in 5 countries. The key finding: treated nets continue to be a highly effective tool in the malaria fight, even in areas where mosquitoes have developed resistance to the insecticides used in them. While the study findings are encouraging, WHO continues to highlight the urgent need for investments in new malaria-fighting tools to accelerate progress. On the 17th of November, WHO announced that the world's first malaria vaccine would be piloted in sub-Saharan Africa in 2018. The vaccine, known as RTSS, provides partial protection against malaria in young children. It is being evaluated as a complementary tool to the existing package of proven prevention, diagnostic and treatment measures. This year's World Malaria Report, released on the 13th of December, shows that children and pregnant women in sub-Saharan Africa have greater access to effective malaria control than in previous years. Since 2010, a steep increase in diagnostic testing for children and preventive treatment for pregnant women has been reported across the region. However, malaria funding has flatlined, jeopardizing the attainment of global targets. Progress towards global malaria goals can be accelerated through robust financing, effective programs, and country leadership. The potential returns are well worth the effort. With all partners united, we can defeat malaria and improve the health of millions of people around the world.